I started was by being a victim of my own ignorance and the greed of dentists. And I realized that this was a losing proposition in the long term. So I tried to research how to find solutions to my oral hygiene problems. And I did find some natural remedies. It worked on me. And then I thought, well, now I can share it with others. And so my business started by with dental hygiene products. And it's our #1 business today, but we kept adding on to it. The secret is to at least make one product that people are satisfied with, because that builds up confidence in your company. Then whatever you add on after that, if it's of the same quality, then it builds up such a threshold of confidence that you get a loyal following. So you can have the best product in the world, but unless you can sell it, you'll go bankrupt. So marketing is important, but more than marketing is being sure that it reaches a level of excellence where it actually, more than 80% of the time, the customer is satisfied so that they come back. So you don't need to have 15 products. You just start with one product at least that really works, and that's the beginning, that's the bedrock of your company. And then based on that, there's confidence, there's, let's say, faith that, I'm going to follow this company. I'm an aficionado of this company. So whether it's service, or it's a technology, or it's a product, whatever it is, it's got to please the customer in the end. And to the point where they want to come back again and again and take your service. Good.
Okay, I'll talk about it from being a very early stage young company and what kind of got us here on this panel, which is kind of surprising, frankly. I mean, first off, for us, advisors and people who could give us just guidance was really, really important for us early on. We're still early, and so that was really important. There were people from Primera that were helping us, kind of guided very informally, and it's not hard, but when you talk to the right people, they can give you so much wisdom, and just by asking, and being open to the criticism, and just being completely, being very, very naked with the questions you have, and not being afraid to be vulnerable. Saying, I don't really know what's going on here, or, I know this is not quite well thought out. And it was amazing, the people that we ended up talking to, how open they were and willing to help and share. The other part of it, and I'm going to probably reiterate what the panelists said, but it's really helped us because partnership is one big deal. I mean, getting selected as a finalist in this developer challenge is a pretty big deal in the healthcare community. Robert Wood Johnson Foundation is probably, to me, it's a better form of validation of where we're going and the path we're headed towards than any Techstar or incubator at all. And so, to me, that partnership has really helped us and will continue to help us, because now we're going to get introduced, and we'll be working with some of the people in the foundation, working on the back-end data and helping understand how we can use our systems to help the Robert Wood Johnson Foundation's efforts here locally to drive health outcomes. So partnerships one, and lastly, and I can't underscore it at all, it's the team and the people that I'm working with. It's the bench strength that I've been able to access and the people that want to work. I pinch myself every day when I think about, and I look at the quality and I look at some of the things we've already had to go through in the last 3 months in such a short period of time. I still can't believe it. And it's snowballing, which is crazy. I'm just barely hanging on, trying to keep it all together with duct tape, but it's amazing. So, and I think that's probably one thing, if you're thinking about starting off something early, generally healthcare is something that people get interested in or enthused about, because people want to do something good for the world, rather than just putting out another app that tells you what's the next best restaurant you should go to, right? Capture that, utilize that, and capitalize on that, and create that passion and enthusiasm. And that's really important for
So everybody, healthcare in the United States is what, 17% of GDP, or so that makes it like about a $2.5 trillion a year market, and the market's in flux. So the opportunity, on a broad sense, is there for you, and hopefully what the panel has been able to tell you will give you a little more juice in the veins to move out there and try something new. So I think the way this works, right, Mesh, is that
the audience, yeah, we can have audience to ask questions if they have.
Okay, so if there are questions, just raise your hand and I'll call you. Otherwise, then we'll move someplace that people can just come and network with the panel here, right?
Yeah, but usually we have questions, so for sure.
It was so complete. Yes.
I have a question for Joaquin. Is your company similar to Happify a little bit? I don't know if you're familiar with
Which one?
Happify, which is basically a company where they use different methods, games and things like that, and activities to kind of measure happiness habits, and your happiness habits.
It's a little different because what we're trying to do is drive the specific types of behavior change. And I'm going to call Samantha. She can tell you a little bit more. She's our clinician from the University of Washington if you want to have a little bit more of an in-depth conversation. But really what we're trying to do is there are certain things that people should be doing on a daily basis, like if you've got anxiety and depression. One common measure about that, if they're on medication, is medication compliance. Are you taking your medication? That's pretty important, but a lot of times most people know you don't do that, right? Especially if you're depressed or anxiety or anxious about something. Or there are things that we're trying to get people to do, or just frankly provide an experience in the day that distracts them from everything. That then when they go back to their daily lives, they can focus on the things that they want to do. So we're not necessarily trying to measure happiness per se, but what we're trying to do is actually change what they're doing on a day-to-day basis. So Sam, do you have anything else to add?
Yeah, I mean, I think we can, if you like, we can talk about specifics out there or wherever. But one thing I guess I would add is that part of what we're trying to do is also build a skill set and teach specific stress management skills, like Sophie mentioned, that are evidence-based and have a good set of literature behind them that we know that they're effective. But what we're looking at this as a new modality of how to reach consumers or patients or whatever we want to call them, and to use new technologies to reach them and to teach these types of skills in a way that is easy for them to utilize, provides a lot more access, and hopefully will help them manage a lot of things in their day-to-day life. So, I don't know if that answers the question.
Can you give some examples of the modalities that you're using to change?
Perhaps it would be best if you did one example of the situation or an app and how that relates to the health outcomes that you're predicting.
I couldn't hear the question.
Perhaps it would help if you did one example of an app or a game and then how that impacts the health outcomes that you're
Sure.
predicting.
Well, so this is kind of interesting because you're just starting to see some of these apps come out. One example, it's not specifically medically, there aren't any apps that are doing medical conditions yet. You'll probably start seeing them. There are some that are, but like in terms of gamifying or gamification, that's a big term and buzzword you're getting here, and it's overused and it's basically been bastardized in a lot of ways. But there are a couple of apps that are using games. Lumosity is a very popular one that you've probably heard. You train your brain and have fun. There's also Nike Fuel Missions is another one for health and fitness, and Zombies Run is another app that I think are really good and I think are kind of pushing in that direction of creating these compelling gaming experiences. But in terms of driving health outcomes right now, it's new. That's what we're trying to figure out, and that's what we're trying to understand. Can we use these mechanisms to drive these health outcomes? So far, it looks like you can, but can you do it in a sustainable fashion? Don't know.
Yes.
I have watch out for that?
That depends on your level of determination and your ability to analyze a potential market. So there's always supply and demand. So there are a lot of people now, as you can see, who are looking for organically grown food. Even Safeway and Fred Meyer, they never had it before. Now they all have organic sections. And a lot of that comes from California, from Mexico, from South America, in the wintertime. And then, of course, more locally in the summertime. So there are things that you can grow all year round that have, a specialized market, like herbs, for example. Herbs are perennial, most of them. Not all of them, but many of them are perennials. They're easy to grow, and it has an all-year-round market. And if you have, greenhouses, then obviously it requires investment. But if you have greenhouses, you can grow them all year round. And so there are other things like that. Like you don't have to have even dirt. You can grow, sprouts. Sprouts, you get a new crop every 5 days. It's organic. You control all the conditions, right? And there are other things too. There's transformation. You can buy certain things that are not grown by yourself, but you transform it into living foods, raw natural foods. The raw market is an emerging market now, and more people are looking for raw food alternatives. So you see there are many, many variables here. It requires, getting a lot of information, talking to people, and then seeing, where you fit in on your level of investment and time. But once you get into the market and you actually build up some customers, like I have a friend, he grows wheatgrass. That's the only product he has. But he has a whole business based on growing wheatgrass, and he grows it all year round in a greenhouse, and he supplies many stores. You can also sell direct to the public. You can deliver to homes. Either he can deliver you the wheatgrass or the frozen juice or the wheatgrass capsules. You see, so there are many different ways of getting into this market. And usually people are willing to share information with you, and how to get into it. It's not like some secret. It's not like Monsanto or something like that. And even the health food stores will support you because they want locally grown merchandise or produce.
Yeah, actually, there's a place called Viva Farms, and they're up in Skagit Valley. Basically what they are is an incubator for people that want to learn to be local organic farmers. And generally speaking, their whole premise is that to get a full-scale farm is far too expensive, and you would never know how to run it. So what they do is they've actually have both the land that you can get a small plot, and then they also teach you. There's shared equipment. They have channels to the market already established, and there's shared packing facilities and all of that stuff. And their whole thing is to produce the next generation of farmers, because most of the farmers that are up in at least the Skagit Valley area, most of their children do not want to be farmers. And so there's going to be this massive gap that comes, and this huge opportunity. But most of the people that want to be farmers today don't know how to do it right now. And they need to learn how to do it, and they need to work their way up to it. And so they help you figure out how to start getting some of those subsidies after you've done it for, I think it is 3 years, but you should definitely check them out. It's called Viva Farms. And then there's another company that started recently that's doing similar to what you said, called Urban Harvest, and their whole premise is to have the greenhouses on the rooftops and then distribute the produce locally. So 2 areas to kind of check out. They were actually a finalist in the business plan competition last year.
I'm not quite sure the URL. It's Hirabara, Hirabara. I think it's hirabarafarms.com. They're in the Big Island of Hawaii. But one of the things that they've done is that by growing it organically and the way they've grown it, they have proven, or at least they've convinced every major chef in the whole island chain that their produce is the best. So So they're now maxed out. They have West Coast chefs wanting their product. They just can't even do it, or they don't want to do it. So there are many different ways of, I think, getting started. Wow.
Go ahead.
So in terms of predictive models, and I believe David mentioned about that, so you can either partner with some industry or some hospital that have the data and have a need, and you can build some models for them. So I was hoping to get advice on how do you actually identify what are the needs, how do you partner with them, how do you find out, and what was your experience in working when you talked about figuring out about heart failures and things like that, predicting them. And so that's one way to go, where you partner with somebody. Are there other opportunities where you basically build your own app or something where you can actually directly face with the customers and you can provide a solution which is based on machine learning and predictive modeling?
So you got like 4 questions rolled up in there. All right, so how do you identify a partner? How do you identify a particular space? And then do you need a partner, or can you just go on your own? So for us, identifying a partner was pretty easy because we partner very closely with Multicare Health Systems. It's the largest hospital chain in the South Sound where our center is located. We had a student who graduated from the master's program. Ankur's motion at me at the phone.
You can also talk about the Fred Hutch.
Yeah. So we had one of our students was an employee in Multicare, so that started that. We did congestive heart failure because it's one of the biggest expenses in terms of readmission. So we have another partnership with Fred Hutch where we're looking at how does your nutrition affect cancer. So we've got a mobile app that takes like a picture of my water bottle. It will record it. It will estimate the volume of the water. So we can collect this long-term data on how are you consuming food as an individual. And they've got some trial studies running. So how does that correlate to the cancer patients, the reoccurrence rate? So those were just kind of a couple of natural partnerships that emerged based on shared relationships and stuff like that. One of the benefits of the partners is that you get special access to real data. There are lots of data sources, anonymized data sources like the National Inpatient Data Source that you can have access to as an individual. But then you need to have a background in healthcare so you can at least understand what you're looking at, right? So, I mean, it's a hard problem to solve by yourself. So, do you have a particular interest in mind, or do you have a particular space that you're looking at, or more of a general, how do I go about setting?
More of a general. So in my day job, I work at Bing trying to figure out what local restaurants to recommend to people. So in my day job, I work at Bing, and we try and figure out what ads and what search results to show to people for different queries. So it's basically a bunch of machine learning algorithms that run on production scale, and trying to figure out. So advertising is about $500 billion industry, and this, as Ted mentioned, is $2.5 trillion. So it's much bigger space, and as the panelists mentioned, it's many years behind. And also, we all have families and parents and ourselves who've gone through different medical conditions. So it's sort of good to help. So just about anything there which can sort of be predictive in terms of what are the things people can change in their lifestyle to avoid certain diseases or certain illnesses.
Right. So then there's two scenarios. There's kind of the more general approach and the specific one. I'll speak a little bit personally now. I have ulcerative colitis, and it flares up when I eat certain foods. Like I enjoy the pizza, but it's not very good for me. And if we bring it back to this, I was thinking about this earlier today because we had a meeting at Fred Hutch. If I'm logging all of my food and I record I'm having a piece of pizza, it would be nice to kind of have a reminder. Yeah, that looks great, but do you really want to do this, right? So if you can bring it personal, if you can supply a need that someone either it's a problem that you're facing or a family member, then that helps you sort of internalize the problem that you're trying to solve, and it will really drive the passion. Beyond that, there's a huge amount of problems that can be solved. So pick, a particular one. So I was talking to one of the audience members. He has a company in Oregon where they log vending machine food. So they've got some information about the sales and stuff like that. So, maybe you are passing by a vending machine that has a particular snack that you like, and it says, hey, you're right here, you should try this snack. There's a lot of areas. So do you have any particular contacts that are interested in, or do you have a particular problem that you want to attack? Or is it more like, here's a really good opportunity, let me grab it?
Yeah, I was just curious if you might have some ideas where there's this opportunity of you can take predictive modeling and solve that particular problem a little better. I'm not in this space, I'm from the advertising space, so I don't have much knowledge about healthcare.
So there's one application I can think of where there is predictive modeling and it's used now, and the constraint in terms of broader adoption is not necessarily the data and the modeling, but it's how you sort of acquire the data from the patient. So there's something called a carotid IMT. Essentially measures the thickness of the wall in the carotid and whether there's plaque there or not. And so what that does is a very highly accurate predictor of cardiovascular event or stroke, and it's significantly superior to the current approach now. So if you look every year, there are about 900,000 people that have a cardiac event in the U.S., and half of those people, that's their first symptom. So when you go to the doctor and they ask you if you smoke, and they look at your cholesterol and ask if you had someone in your family have heart disease, that's a very poor predictor. But the reason it's so prevalent is because it's easy to do. And so you can send some blood work in lab and ask a few questions if you feel like you've done work. The challenge is with this, you've got to take an image here and measure. So a lot of times the challenge is not necessarily the data, but if you can come up with a mechanism to make that data acquisition easier.
Now we're here.
So that's the difficulty with patients. You go to websites or do Google Analytics, but to get data, you have to go inside bodies or spend a lot of time looking at these.
Thank you.
Yeah, if you go back to the Ayurvedic tradition, see, the main problem doctors have with diagnosing a person correctly, right? If you diagnose incorrectly, you can kill a person by giving the wrong medicine. So, and doctors will take a long time to diagnose something sometimes. After all the tests, it could take 3 to 6 weeks, sometimes even longer. But in Ayurveda, they have a pulse reading, which has a very high percentage of predictability, of accuracy. And if you made an app that could correctly read the pulse as an expert Ayurvedic physician, you would have a 70% chance of correctly diagnosing the person. Whereas nowadays, even with all the testing, it's never 100%. So you have to find something that's a little bit different and develop that in an expert way, and all of a sudden you have a more highly performant product than other approaches.
Thank you.
Yes.
Thanks. I have a couple of questions, if you don't mind. The first one is to Amber. I just went to your website and I tried to sign up as a final consumer, and I couldn't. Is your service through employers, or how is this done?
Did you go to Karina MD?
Yeah.
Or did you go to CareSimple? So CareSimple is the consumer service. It's a separate website that is, yeah, so Karina MD is our corporate site that has kind of all of our business units in it. So.
And they are not linked, right?
They are. You can get to CareSimple from there, yeah.
The second question is much more a personal story, but I want to share with you, so maybe you have some comments. I moved to the US last year. The very first night we arrived, my daughter got ear infection. We didn't have the health insurance yet. So I was like, well, what should I do? I went to a Bartle's drugstore. They told me you should go to a doctor because we cannot, prescribe any medicine, right? So I went to UW Medicine Urgent Care. I filled out maybe 25 pages of personal information, right? My daughter was crying. At the end, we were received by the doctor. In 15 minutes, he knew what was that, and he prescribed whatever drops she needed. When we finished the appointment, I say, well, how much is this? And the lady told me, no, you don't pay here. We will bill you. And I say, I want to pay now. I mean, how much is that? I don't have social health insurance, so I can pay now. After 30 days, I came back and say, hey, I haven't received the bill. How much is that? And they say, you will receive it. In 45 days, I received the bill. It was $130, and it says if you pay now, you get 30% discount. So that's so inefficient for the doctor, for the consumer, for the healthcare unit, right? So then I got my health insurance, right? And it's the same. I mean, having the health insurance or not is as inefficient as the other way. So there's an opportunity there, and I would like your comments regarding this.
So there's a couple of services that are coming up online now. You don't have to follow the traditional model, but correct me if I'm wrong, but I think 70% of the people get their insurance through employers, right? So they're going to follow the model that you did, right? But there's also now emerging models where they have this, it's called concierge medicine or whatever. It's basically you pay a subscription to a doctor, right? $80, $90 a month. And you create a relationship with him. And then a doctor visit is $10 a month or $20 a month after that. But you pay on the spot. They basically manage your care end to end. Very highly personalized. Okay. What also happens in that model is the caregiver gets reimbursed directly because you're dealing with them. So the payer, insurance company, is out of it. So you don't have to deal with that headache. But that's the reason why they can't actually bill you, is because they have to actually put the code in. They have to get reimbursed, and then the insurance company is the one that they have to get paid, right? And then they have to fit in. Each insurance plan is different because each employer has a different plan. Each person has, some people have co-pays, other people don't. Some people have high deductibles. That's why they can't bill you. But there are these models, and they're available today. You pay $90 to $100 a month, and then go see your doctor, and then you're done with it. So there are models like that already pretty robustly developed. And what happens on the provider side or the caregiver side is they see about half the patient load, but economically they're making the same amount of money, but they're seeing a half number of patients. Okay. So then in theory you get better care.
Okay. Yeah. That's a huge part of the premise behind Care Simple. So we do upfront transparent pricing. You pay with your credit card and you're done. So we have a similar model to what she's talking about. We've got two models. One is just $85 for a visit, straight up, and the other is $35 a month will cover your entire family. You get unlimited $5 visits. So it's kind of a very disruptive model, a way to get your everyday care. But 40 to 50% of the cost of an office visit is simply for them to pay the staff to administer the insurance claims.
And if it's online visit, how do you prescribe?
So similar to what Harry was saying, in the olden days, before there was very many tests that the doctor could just run, they would ask you a longer series of questions called the medical history. And using that series of questions, they can very accurately diagnose what your situation is. And our visits are typically about 3 times the length of a visit with a regular doctor. You, on average, will get less than 7 minutes with a doctor if you actually go sit in the clinic. It is faster for them to send you to get a test than for them to ask you the right questions. So our physicians and nurse practitioners spend a lot more time with you and ask you a longer series of questions, and then they can diagnose with a very high level of accuracy what you have. Now, we're not going to diagnose you with cancer. We're handling these things that we see every single day, and we've done thousands and thousands and thousands of sinus infections and urinary tract infections and pink eye cases and rashes and burns and cuts and all of those simple things that take up the majority of what you end up going to your doctor for.
Right.
But we don't try to take over that primary care relationship for people that have chronic disease issues and that sort of thing, although we do have programs in development that integrate with clinics in hospitals as a
Right.
part of that care continuum.
But if it's, let's say, midnight, and I have my daughter here,
Right.
ear infection, how do you issue the prescription so I can go and buy it?
So the doctor picks up the phone when they get off with you and calls the pharmacy and calls it in, and it's waiting for you when you get there.
Okay.
Yeah, just like a regular doctor's office. They call it in too, or they fax it, either way.
What
Just
about the
pharmacy has to
liability issue?
I'm sorry, what?
What about the liability issue with your doctors? Because you're only diagnosing with all the questions, you don't have any other thing. So what's the incidence of the data on that? How much is the
So-
liability?
So, we're covered by exactly the same firm that covers the other physicians in their clinics. They actually love our model because, like I said, we don't do these very high-risk things. We aren't going to accidentally cut the wrong leg off. We're handling things that largely, if it is very complex, we'll tell you, and we actually don't charge for those visits. That's part of the consumer service part of this. So we hope to be the first place you call when you have a problem, and we can help assess what your issue is and what the right mode of care is. And if you need to have your lungs listened to properly diagnose you, we will tell you that right away, and then we don't charge you for that visit. We also help you figure out where the closest places that you can go, and let's say you need to go to the ER, we'll actually call ahead and let them know you're coming and brief them on what the situation is, so when you walk in the door, it's a very different experience than, coming in cold. So liability has not been a problem for us. We haven't had any issues at all because we have these consistent practice guidelines, and if your symptoms fall outside of that, we assess that it's not appropriate to treat you with telemedicine, and we let you know that. And we'll tell you what tests you need to have, so.
Is your doctor locally or they are Nighthawk?
They are local, and they are employed by Karina's dedicated medical group.
So they are US doctors, right?
Yes, they all live in the Seattle area, and they're all they're all licensed in Washington and California.
And I think that's part of the regulation, that you can't see a patient that isn't in your state. Is that
You
not
can
right?
as long as you're licensed. So
Yeah,
our physicians cover Washington, California, and Illinois, but they've all been licensed by the medical boards in all of those states. So they can then treat patients in those states.
Because some of the hospitals, they're Nighthawk. They study, they're thinking MRI, CT is going either Australia
Right?
or India
Mhm.
or wherever.
Right.
Same time, their degree is not valid in this country, but
Right.
they can diagnose over there.
Yeah,
So I just want to make sure that how your doctor works, they are local.
they're all local.
Okay.
Yes. Yeah, they all live and work in the Seattle area.
So I've got a question for Karina as well. I'm curious to know about the challenges you're facing in converting people to use Karina, or if you see people leaving Karina to go back to their regular doctor visits. I'm curious to know what those challenges are. If you could expand a bit on that.
It's really early to tell. I guess the important part is we're not trying to keep them from going to see their regular doctor. We think that's a really important relationship, and actually about 20% of the people that come to see us don't have primary care physicians, and we actually help them find one if they if that's what they want. The other thing is that we keep their physician in the loop, so after the end of each visit, if they provide the information, the contact information for their provider's name and their clinic, we will fax over a copy of the records of what they were just treated for immediately. So the next day it's included in their medical record and they have that continuity of care. We think that's really, really important. We treat patients from over 600 clinics in the Puget Sound area through the fact that we treat Microsoft and other very large companies in the area. So we think that's important. However, consumers that are paying out of pocket are obviously going to start seeking the most cost-effective methods to do so. And so far we have a 97% satisfaction rating. More than 97% of the people say they would recommend it to a friend. More than 60% of the people say they would have had to miss work but they were able to use us and they didn't have to. So there's certain things there that, you know, we haven't really seen a problem. I mean, we get handwritten, not handwritten because we give electronic surveys, but, you know, people are generally pretty ecstatic that this exists and are, you know, happy to recommend it to their friends. But, you know, we don't hope to displace regular physicians.
How does that work though? I thought this whole online visit thing is meant to be a disruptive and it's supposed to displace, you know, me going and paying $20, you know, or $25 for the office visit. Isn't that the main idea?
Well, I think the main idea is that there is kind of the right level of care for the right level of issue. And, you know, you don't need to drive and go into the doctor to have them tell you that you can put Benadryl on that rash or that you really need a steroid, you know, something along those lines. And physicians, I think, are tremendously overburdened. I mean, they're working very long days. They can't see everybody. So oftentimes, you know, they have a patient that develops an urgent acute situation like a urinary tract infection. They're tremendously uncomfortable. They either have to try to shoehorn that person into their already full day, or you can just relieve that burden from them and that person's still going to come back to them, because we don't attempt to have a longitudinal relationship. Like, you're not going to call and get the same doctor every time with us. You get who you get when you get them. That's our model. And so they'll have access to the medical records of the last time you had a visit with Care Simple, but, you know, we want you to go back and have your annual visit with your provider. We think that's very important. And so most providers are pretty ecstatic, you know, that their patient had somebody to call at 2 in the morning and they didn't have to call them, because they're pretty busy already.
I think that's one thing that's, if you're thinking even about innovation in healthcare, is think about your solution on how you can help the care provider. And the care provider could be the clinician in this case, or it can be a family member. Anyway, and when you think about it as supportive versus completely obsoleting a role, that's when you're going to start creating that value, because the care providers themselves are just completely, like she said, they're overburdened. There's just so much inefficiency, so that anytime you can make that step easier, that's going to be helpful for them. And that's kind of what we're trying to do with games, because if you can, there are people that aren't going to go to a therapist. There are people, you know, some people don't really want to talk to anyone about it. They're trying to find their self-help tool, right? And if that means, and if then they want to take that information and share it with their clinician, which about 70% of the people nowadays are actually logging and tracking activity and sharing with their doctor, whether through an app or on paper, that's actually really helpful for the care provider. So even though there are these new models that are coming on board, it doesn't mean you're necessarily completely disrupting the entire system. You can actually create new value streams and keep the traditional ones in place.
Right, and one of the things that she was alluding to earlier, the physicians get paid based on kind of the complexity of what you're diagnosed with, which is part of the reason that they can't tell you what it's going to cost you before you go in for the visit. So if you're taking off these kind of low complexity things off their plate, it frees them up to have more time for more high complexity issues where they're actually getting to operate at the top of their game. I mean, doing first aid really isn't using the full thing, you know, breadth of what they had to learn in school. I think most physicians would rather be working on the complicated cases where they actually have to use their brain power and really think it through and analyze a series of complex events, as opposed to just looking at yet one more ear infection. You know, so I think that there's room for everybody to play, especially in an industry where it's so hard to get transparency. I mean, I think one of the other things that's an opportunity for people is that all of the prices that are negotiated with the insurance plans and the providers are confidential. So that's part of the reason that you cannot get this transparency. And there's a lot of organizations out there right now, or at least a few that I've seen, that are trying to get patient-driven data on what they had to pay for that service and then to rate it. And so that's another area of opportunity right there, is how do you create transparency in an industry that is prohibited from creating transparency? I think that you can use kind of grassroots efforts to do that, and so there's some possibilities there too.
I have a question for Harry and Swati. I wanted to know, do you think that spirituality can be commercialized? And do you think that the self-help and natural medicine arena is doing that? And how can an entrepreneur go about doing that more efficiently and more innovatively?
When you're dealing in holistic healing, you're dealing not only with a person's body, and the body has two parts to it. There's a gross body made of earth, water, fire, air, and ether, and there's a subtle body made of mind, intelligence, and false ego. And then both of those bodies cover the soul. So in Ayurvedic medicine, there are medicines that treat the gross body, there are others that treat the subtle body, and there's others that are meant to, let's say, awaken the soul from basically a slumbering situation where the modes of material nature act on the body, and we're like forced to do things. Like you eat, you're forced to defecate. You work, you're forced to take rest or sleep. You're forced to breathe, you're forced to blink your eyes. Sometimes out of nowhere you get angry and so forth. So these material forces are acting on the body. So to treat sickness, sickness starts because of misconceptions that we've developed. So you can't only deal with the body, you have to also deal with the mind and then ultimately with the soul, because the soul is in the heart, and that's where blood fusion takes place. You know, no one's been able to recreate or manufacture artificial blood because something mysterious happens in the body. There's a type of fusion of blood that takes place, and it reproduces itself. They've only been able to make sections of blood, but not the whole thing, where it actually reproduces itself. You know? Because there's something extra material that happens in the heart, where the blood comes back to the heart and it's re-energized. So therefore, a holistic approach would consider those three elements: the gross body, the subtle body, and actually the soul.
Do you have any suggestions as to where somebody can learn more about that, those three parts? Anything that you
Sure.
have?
Well, you can. You're going to find out about that in the Ayurvedic system of medicine, which incorporates all three aspects of the person. And there are many sources of information. Or you can also contact me, give you more specific information about it.
So, could you repeat the question? So I get it right?
I wanted to know spirituality, basically, if it could be commercialized, and if that was what was taking place with like holistic healing and natural medicine and things like that, and self-help tools like yours and things like that, where they're basically sparking behavior changes and habits in people's mind to basically spark a chemical reaction that will affect them, you know, in their daily life. And I wanted to know if that's how you guys were basically commercializing spirituality.
Well, I think you can, the way I'm hearing your question around commercialization of spirituality, I keep thinking of Rick Warren and Dr. Deepak Chopra as the two people that come to my mind about people who seem to do that pretty well. So I think there's probably a ton of other people that have managed to do that, right? And I think the point with any type of, when you're going down that path, is the point of authenticity. And I think the reason why they've done so well is they have a point of view and it's authentic, which means there are certain things they don't cover, as well as things that they will focus on. So I certainly think there's definitely opportunity for that. I think there's even, I've seen apps for spirituality as well, you know, daily prayers, or there's a couple that help with meditation, right, in terms of spirituality. So absolutely, I mean, definitely you can commercialize it, but it's a tricky thing though, because if you become inauthentic about the message, then you can't really, you just become one of those shills selling snake oil, right? Because that's one of those things, right? So it's about being true and authentic and being real about what you're going to do and what you're not going to do.
Are you familiar with Bastyr University?
I'm sorry?
Are you familiar with Bastyr University?
I'm not.
They're about 5 or 10 miles from here, and they are an accredited university, and they do naturopathic medicine I'm just guessing or assuming that if you contacted them, that they would be able to help you also.
Yeah, they're one of like the leaders in holistic healthcare delivery. So that's a good resource if you're looking for those kinds of things.
Okay, great. Yes.
I have a question for Amber and the others can answer too. So for a company operating in this space, is there any compliance regulations on how the company can handle patient information? So in other words, can ordinary company, just a startup, can handle medical records in compliance with the regulations without it having to be a big company?
Well, you know, I'm certainly not an expert on that side of our business. I will say that, you know, there's a lot of regulations in place that I think are a fairly large barrier to entry. HIPAA compliance being probably the least of them in our field, at least. Not that it's not important, but there's just a lot of complexity with how you have to set up the corporate structure and how you have to handle patient records. And, you know, I mean, you have to take into account things like, you know, is cloud computing going to be compliant? And it really has to do with levels of control of who has access to what information and why. So there's a ton of systems. There's even like freeware versions of EMR systems and things like that available. But really it's the wrapper of how you build your business around that. Those are just tools. So I mean, it really depends on what you're trying to do with it.
Yeah.
So are there many startups that deal with this kind of data?
Yeah, you can find, depending at what stage you end up at, there are tools and there are companies that specialize in precisely that, right? They do HIPAA compliant, like if you need text, be able to text in a HIPAA compliant way, there are partners and companies that provide those solutions already. And there are there are tons of startups doing in this space, and even though it's highly regulated, the FDA is actually doing a pretty good job of keeping their hands off, which is part of the reason why you're seeing so much innovation in the last 2 to 3 years. They've actually taken a backseat in terms of the regulation because it's not something that's being a device, unless now you talk about embedding something into someone's body, that's a different story. But for the most part, they've kind of taken a backseat and just let the ecosystem grow. That being said, it's more about patient privacy. And now there are going to be certain apps like an EKG that you can run off your phone or ultrasound that are still going to require the regulation. But there are solutions available as well and service providers that can help you with that. And now you're also, even to your Amber's point, even cloud solutions are now also becoming HIPAA compliant. Right? AWS, I think now you can actually host your own private cloud. That's going to be a big deal, I think, for startups who want to do this stuff in the healthcare space, because now you know where the data actually resides, right? You've got your own private cloud that you can wall off from everybody else.
So I would just add, because we're highly regulated, so it's a class 2 medical device, and a big part of our solution is patient data, and we've got systems to set up email data, to send it to storage, to send it to the cloud. So it's a very important issue. I wouldn't minimize that, and there's a degree of complexity to it. But on the flip side, it's not rocket science, and so people, when they think about medical, they get very scared about that because they hear these words like HIPAA compliance. I don't know what that means, but it sounds really scary. You talk about FDA regulations, you're talking about quality systems, those sorts of things. Right now, we have 7 people in the company, and we've got FDA class 2 device cleared. We've got HIPAA compliant systems. So if you understand that there's hard work to do, and you want to do that, that's not a barrier for you to run a business, even running on a lean platform. But if they are real, and you take the decision that you're introducing a significant risk factor into your business model, because if you're not compliant with quality systems or you get audited, think what you'll see is, when you look at sort of healthcare, particularly regulated companies that have gotten through that initial period of difficulty and learned how to deal with complexity, once you get critical mass, it's very hard to kill those businesses. On the flip side, you have MySpace has zero barriers to entry, and it can grow very quickly, but it can disappear very quickly as well, because it's so easy for competing solutions to come out.
I might mention that these regulations are tough, but there's also ways around. For example, our business is web-based products that we're sending medical information to prospective receivers of a patient. So we might send it to 5 different nursing homes, for example. The way that it had been done prior to that was the hospital faxed the information over to the nursing homes. And so a lot of the HIPAA regulations were how do you get rid of paper faxed products when the patient does not go to that nursing home. By sending it on a web-based approach, it actually eliminated about 90% of the HIPAA requirement, because we have a secure website that they could see if they could see the medical documents. If they did not receive the patient, we just shut down that site to them. So when we presented this to the government, they said, wow, then you only need to comply with these 10% of HIPAA. So I think one of the folks said that the regulations are real tough, and if you don't follow them, you're out of business. But on the other hand, this is one area where we have found that the government is very interested to talk to you about how your system complies with what they have, and even changing the regulation for you. Okay, so we've got about a couple of minutes, 1 or 2 more questions.
I had 2 questions. One is for Dr. Das or Mr. Das. I came late, so I don't know everybody's designation. But you're doing supplements, I understand, and natural health, right? I am in functional medicine also, and that's the newer field where you have molecular medicine and all the supplements and everything, and biochemistry and all those things. And my question is, when you started out, how did you get your products made, first of all? And are they GMP certified products? Or, where did you get those? What's the purity of the product so that there are no metals and other things in there? And how did you make sure that it's that way?
Okay. Well, as I said, I started out with oral hygiene products, right? So you don't swallow those products. It comes in contact with the body, but it's usually spit out. And I used USP, in other words, purified products that are edible. They're food-grade products as ingredients. Okay. Then later on, I added supplements, or what you call nutraceutical foods, or superfoods. Okay. So then again, those products are usually only certified organic. They have, a sheet that comes with it from the supplier about the microbial and heavy metal, content that, is in safe zone. So I work with credible suppliers of raw materials.
Locally, or you get from other countries?
I try not to import. I try and get from people who, if they import, they have chromatic, spectroscopic analysis to verify that what they're getting is actually the real thing and compliant with American laws. Like, for example, in Ayurvedic herbs and medicines coming from India, there's a high level of heavy metals in them, and the FDA cracked down on it. And so it's better to work with reputable companies unless you have the infrastructure to test the product yourself, either at the country of origin or when you actually get it, to make sure it's compliant with the American laws. So I usually try and avoid reputable importers or manufacturers in this country who are under FDA regulations.
And the second question is for you, who are making ultrasonic devices, right? And those devices, again, because I came late, I don't know I came from a distance, so I don't know what level you're using. You mentioned the carotid, carotid deposits or other things like that. So is it being used only for medical use, or is it being used used by the consumer also, whatever you're inventing right now?
So it's only being used for medical use by clinicians, but I think the difference is when you look at the sort of the population who has access to that. The traditional model used to be, let's say in the U.S., there's sort of 5,000 hospitals, and you have one radiology department. So if you need an ultrasound imaging, typically would have gone there, or some of the larger OBGYN practices would have that. So you're talking about sort of population of about 5,000, but when you start making it accessible to all kinds of clinicians, so there are 250,000 primary care physicians in the U.S. and tens of thousands of other specialties, you start pushing that capability out closer to the consumer, so you can have ultrasound at the physician's office. One day you'll have ultrasound via telemedicine, right? Probably. So that's, but where we draw the line is at sort of consumer orientation. Is that something that could happen in 10 years? Definitely. We do get calls from consumers now because it's a skill, you have to learn it. But again, it's not rocket science. And some people have a natural curiosity and would like to do that. But because of our regulated environment, we have self medical professionals.
So the related questions are, what's your model of business? Are you just based in one place, or do you have distributors, or how do you do this? Because you're going to other countries too, obviously.
Yeah, so we have distributors, and then we also have a direct sales effort that's really focused at the hospital, and we use distributors for private office space. But as we think about how we roll out the distribution, we're also looking at partnerships with entities like the Gates Foundation, because this is a perfect technology to take out in sort of underserved areas where you don't have the technology and there's a remote role because it's mobile. You've got the data transfer. So it's a multi-strategy approach, but it'll evolve over
So
time.
is there an opportunity for entrepreneurs there to combine with you and do something?
We can continue the questions one-on-one, okay? Because the city of Bellevue has a limit for us for having that discussion. Sorry to interrupt that question, we went with. So I think with that, let's have one round of applause for all the. Thank you very much. I think this was a phenomenal thing. I can see the passion in every question and going on and on, but we can continue one-on-one because of the limit of the time we have here. I want to take this opportunity to again thanks all the volunteers who are standing behind to make this thing happen. So one round of applause for all our volunteers. Just to remind you, we have another event on May 14th, Startup on Tap, which is a monthly social, and on May 22nd with